will continue then. Anyone reply me? Are you listening me properly? Our today's topic is contraceptives. Okay, there is answer. Okay, yes sir. Thank you. Thank you. Okay, contraceptive, means to avoid the pregnancy, to avoid the conception, right? To avoid the conception. That is why it is labeled as contraceptives. Drugs used to prevent the conception is labeled as contraceptives. I think already we know that already you have taken the individual lectures on estrogen and progesterone, right? So little bit we are going to revise, because in contraceptives two major hormone take place a key role: estrogen and progestin. These are labeled as female sex hormones and released from mainly from the ovary, right? So function is to, number one, conception, because they facilitate the process of conception, embryonic maturation, and development of primary and secondary sexual characteristics during puberty, and are used therapeutically, right? Estrogen, natural estrogen, that is the estradiol, in which we have 17-bene estradiol. This is the major and the most potent estrogen. We have estrogens which are available, steroidal, like ethinyl, estradiol, mastrenol, and quinestrol. We also have non-steroidal preparation, diethylstilbestrol and chlorotrianisine. These ovarian hormones, estrogen and progesterone, this is important point, they are steroids, right? So why it is important to know that these are steroids? Because mechanism of action, if anyone asks, okay, if any preparation that is steroidal in structure, how they are going to produce its activity? So at which level they are going to produce activity, mechanism of action. In another way, anyone can ask the mechanism of action of these steroids at which level? At cell membrane level, in the cytoplasm, or at nucleus level? Anyone? So any steroidal preparation, so mechanism of action. Anyone? Okay, there is an answer. At nucleus level. Very good. At nucleus level. First, these steroids crosses the cellular layer, enter into the cytoplasm, where it bind with the receptor, so it will form a steroid receptor complex. And these steroid receptor complex, they are going to promote or translocate at the nucleus level, right? So where the gene transcription process will take place. So that is why the onset of action is slower, but the function is more potent when the new proteins have been formed, right? So the action would be potent and prolonged. Okay, this is the regulation of female sex hormone. The hypothalamus is responsible to release gonadotropin releasing hormone, and it will act on anterior pituitary, and from anterior pituitary gland, FSH, follicle stimulating hormone, and luteinizing hormone act on ovary, and then estrogen and progesterone is released. So estrogen is released under the influence of FSH, which is follicle stimulating hormone, and progesterone is released under the influence of luteinizing hormone. Now, progestin, the natural progestins, that is the progesterone, right? We cannot give progestin preparation orally because it would be ineffective. So usually we give the intramuscular preparation, right? We are talking about the natural progestin because synthetic progestin can be given orally, right? Can be given orally. So synthetic progestin examples are medroxyprogesterone acetate, hydroxyprogesterone acetate, that is, this preparation is given intramuscularly, norethindrone tablet, norgestrel, and desogestrel. So these are the synthetic preparation of progestin. Now, contraceptives, drugs or devices used for prevention of pregnancy, and we can use either estrogen or progesterone alone or in combination, right? So that we will see what are the conditions in which progestin only pill is given, right? So usually the combination of estrogen and progesterone that we use as hormonal contraceptives. So hormonal contraceptives will cause reversible suppression of fertility at will. This is important, right? Because you know there are some drugs that produces its activity irreversibly or permanently, but these are the properties or important point that during the period when we are taking these preparations, we are going to suppress the process of ovulation, suppresses the fertility process, but it is reversible, right? It is reversible. If the couple, they have decided, okay, now this is the time to conceive, to make a family. So if they are going to stop taking these preparations, right, again the fertility can be restored. So that is why this is the reversible suppression of fertility at will. Over 100 million women worldwide use hormonal contraceptives. So this is very important slide. Types of hormonal contraceptive preparations. Okay, before starting or before discussing the types of different preparations, I just want to discuss the medical legal importance of using hormonal contraceptives. So, what is the explanation of this medical legal use of contraceptive preparations? Because as a doctor, when you are in a clinic or you are doing practice, okay, suppose you are gynecologist, even if you are gynecologist, right? So there are certain conditions in which, you know, using contraceptives or is illegal, right? So in forensic medicine, I think you will do, maybe you have done it, I don't know, but in forensic medicine, you must be aware different terminologies like criminal abortion. So this is very important to know the medical legal importance of using hormonal contraceptives, because sometimes some persons, they can misguide you that okay, uh, the activity has been done, we are coupled, we are legal coupled, and now we want to avoid this pregnancy, this conception. So in that situation, we'll have to give the preparation that is labeled as the emergency preparation or post-coital contraceptives, so to avoid the conception. So this is your responsibility. So rule out whether is there any medical legal point that links to that case, because I have experienced two cases. So one of the cases related to my friend's friend. Okay, one day they called me. Okay, one of my friend wanted to use emergency contraceptive preparation. If you know about that preparation, that can be taken to avoid the pregnancy, because they have taken the unprotected sex, and at this time they are not interested to be a parent. So first I confirm that you know them personally and really they are a legal couple. So he verified. In spite of that, I didn't discuss that on that mobile, or I didn't give the written message even on mobile, right, to avoid the any legal complications. Because you know sometimes there are some side effects that can occur. Even sometimes that female may die, right? So definitely there will be a problem for a prescribing doctor, right? Number one. Number two, sometimes illegal cases can come to you. So even if you are a gynecologist, you must know what are the indications of using hormonal contraceptives, what are the contraindications, and at the same time at which time if you will use the contraceptives, that would be a criminal act, right? So why I have explained it to you, because I have faced these cases, and so you must know the medical legal importance of using these contraceptives. Because as a doctor everyone knows, because gynecologists, they refuse to give contraceptives, so they try someone who knows the medical knowledge and prescribe that. Clear? So now types of hormonal contraceptive preparations: oral preparations, parenteral preparations, and implanted preparations. Right. So one by one, oral, as I told you, the combination generally and commonly use the combination of oral contraceptive pills. That means the combination having both component estrogen and progesterone. In the beginning, we have discussed that these are the two hormones that play a key role. So we can give estrogen, either estrogen alone or progesterone alone can be given. But very effective preparation, that is combination preparation, is supposed to be the very effective preparation, right? So in which we use both estrogen and progesterone component. Second important type is the mini pill, and that is also labeled as the progestin only pills. So definitely, why we are going to give the progestin only pills? Because if a patient cannot tolerate the estrogen component, and conditions where use of estrogen is contraindicated, so in that situation we can use the mini pill or progestin only pill, right? But another point that I want to discuss, that combination pill is supposed to be the most effective preparation, right? So the failure rate is less. If we use the progestin only pill, that is not more effective than combination pill, increased chances of failure rate. The third type is the post-coital contraception, estrogen alone or combination of estrogen and progesterone. And this preparation, post-coital contraception, is also labeled as the emergency pill, right? And this emergency pill, this I was talking about, that where we are required to give this emergency pill or emergency preparation if we give within the 72 hours of coitus or activity, because sometimes the use of this preparation is legal. For example, the case of rape, right? So in which we have to avoid the future consequences in that female. So I think that would be legal. So if we use in a case of rape to avoid the future consequences for that female. So parenteral preparation, that is the injectable preparation, and usually which parenteral route we usually prefer, and that is the intramuscular injection. That is the medroxyprogesterone, and this injectable intramuscular preparation would be sufficient and give a prolonged suppression of evolution. Then implanted, that is the tubes. These are the tube form preparations that is placed below the skin, right? So usually 5 tubes are placed below the skin, and it will give the contraception for about 5 years, right? Because it's a slow releasing steroids. So one of the key example that we use as implanted contraceptive preparation, that is the norgestrel, right? So you must know this norgestrel belongs to which group? Estrogen group or progesterone group. So these were the examples of estrogen, in which steroidal, ethinyl estradiol, mestranol, quinastrol, and these are the examples of progestin. So here you can see norgestrel. So this implanted preparation having progestin. Now, one by one, the oral preparation. So the most effective preparation supposed to be the combination pills, in which we use both estrogen and progestin. Mechanism of action: this estrogen and progestin, they inhibit ovulation, and progestin component is responsible to produce bleeding at the end of cycle to maintain the normal menstrual cycle. You know, when there is due to follicle stimulating hormone, ova is released, and with the help of luteinizing hormone, right? If fertilization occur, so there is a chance of conception. But if fertilization doesn't occur, so what will happen? You know, there is shedding of the endometrial layer, right? So what is the question, sir? But there is a question that is, but doesn't progesterone increase the vascularity of the endometrium? So that is required, because what I was telling you, if there is no conception, so what will happen at the end of, there is shedding of endometrial vessels, that is the menstrual bleeding. This is the normal cycle in female, because when we know after the marriage, if there is no menstrual bleeding, so female think that I have conceived. So that is why the easiest method is to check with the help of pregnancy strip, because this is the bleeding that indicates the normal menstrual blood flow on normal bleeding at the end of menstruation. If there is no bleeding occur, so this is the indication that that female has conceived, so that we can confirm, right? So this, to maintain the normal flow, this is necessary to maintain the normal blood flow, normal menstrual cycle, and this bleeding take place with the help of this progesterone. So you have already given the answer that you have asked. Okay, this is responsible for increased vascularity, and this progesterone, that is why is responsible to maintain the bleeding during menstruation cycle. And this combination basically blocks the chances of carcinoma, especially the endometrial carcinoma, ovarian carcinoma. But estrogen, the component of estrogen, chances of breast carcinoma. So that is why if a female having a history of breast carcinoma in family, so we usually avoid the estrogen component. So in that situation, we can give progestin only pills in that female. So the otherwise the combination oral contraceptive pills combination estrogen and progesterone, what is the advantages? They prevent the chances of endometrial carcinoma and ovarian carcinoma. This is important point. But estrogen can increases the chances of breast carcinoma. It's not going to prevent breast carcinoma, increase chances of breast carcinoma, and estrogen is responsible for that breast carcinoma. Types of regime. Normally in our setup, we are using monophasic combination tablets, right? So here you can see this is the normal strip, right? So, and if you are interested to go in detail, you can check it yourself by just checking the strip in your hand, right? Monophasic combination tablets. When we say combination, that means we have both component estrogen and progesterone. So ethinyl estradiol or methadone, one of the preparation from the estrogen side, and from the progesterone we have nor ethistrone or digestrone. So either one of the preparation, right? So most popular and most effective, that already we have discussed. So these are the market name or generic name of monophasic combination tablets. Method is important because sometimes, you know, why we should know, even if we are a student, and suppose we are a student of 4th year, so sometimes someone can ask, okay, how we can use this preparation. One of the gynecologists, they have advised to take these preparation to avoid the conception. So then you would be able to explain, right? So method, one tablet daily for 21 consecutive days. So there is a gap of 7 days. And why this gap? To promote bleeding. And this promotion of bleeding take place with the help of which component? Which component of combination pills? Which component of combination pill is responsible to produce this bleeding? Progestin. Very good, right? So if you will see yourself the strip of this monophasic, in which you will find that there is they introduce the blank tablet or placebo tablets, in which there is no estrogen or progesterone, because sometimes the female, they are unable to memorize, okay, how many days I haven't taken the tablet. So that is why, to avoid this problem, right, to avoid this problem, to fulfill this gap of 7 days, to there is placebo tablets in that strip that can be taken during this gap period. So why it is important? Because they can again start after that taken placebo, they can again start the next strip for the next cycle. Now phase regime, there are other regime that is available to keep low total steroid dose, right? And recommended for women over 35 years. Constant estrogen dose varied slightly, and progestin low in first phase but high in second phase to maintain the bleeding. So on that basis, we have again divided the regime phase preparation in biphasic and triphasic. Here is the explanation. Biphasic, that means the first phase, that is from day 1 to day 10, one set of tablets, and second phase, that is from day 11 to 21. And you know, there should be a gap of 7 days to maintain the normal bleeding, normal menstruation. right? So concentration of progestin increase in the second phase, that already we have discussed, that in the first phase, the level of progestin is low, but in second phase, the level of progestin is increased. So these are the market name or generic name of this biphasic combination tablets. Triphasic combination tablets, first phase, that is from day 1 to day 6, one set of tablets. Second phase, from day 7 to day 11. The third phase, from day 12 to 21 days, and there is a gap of 7 days, right? So these are the different generic preparation or market preparations of this triphasic combination tablets. Methods of triphasic tablets: first phase, that is the ethinyl estradiol plus norgestrel, almost equal concentration. Second phase, doses of estrogen and progesterone increases, right? In third phase, dose of estrogen is decreased and in dose of progestin is increased to maintain the bleeding. Gap of 7 days, so the bleeding will occur to maintain the normal menstrual bleeding. Now, this is important. Mini pill or progestin only pill. The important point already I have discussed with you. What are the conditions? This you know. What are the conditions in which we are required the progestin only pill or mini pill, right? And the method is, you know, what we have discussed in the combination pills, right? Either we are using monophasic or we are using biphasic or we are using triphasic preparation. In all those preparation, there is a gap of 7 days, right? But if a female is on mini pill or progestin only pill, there is no gap. This they will have to take continuously without any gap. So this is one of the problem, psychological problem, you can say, that continuous they will have to take these mini pill or progestin only pill until they have decided to conceive. So there is no problem, but one problem is the psychological problem. In combination pill, so psychologically, okay, there is a gap of 7 days, right? So yeah. Method: daily without interruption. Indications for progestin only pill: when it is desirable to eliminate estrogen. There are conditions in which a female cannot afford the activity of estrogen. One of the key example is sometimes if a female having a history of breast carcinoma, so this estrogen can be avoided to in female that having a history or having breast carcinoma. During breastfeeding, number one example, estrogen suppresses postpartum lactation. So this is one of the important points. So we cannot give the estrogen component because it can suppress the postpartum lactation. Contraindications to estrogen, okay, hypertension or breast cancer. And a smoker more than 35 years old. So these are the conditions in which we are going to use estrogen progestin only pill. So there is a question: what is the criteria when to recommend monophasic, biphasic, or triphasic? So this is at this level. At this level, you just know the different types. Now this is the this depends on the clinician or gynecologist, right? Okay, these are the conditions in which it is better to give the triphasic combination, right? Because suppose if a female is more than 35 years old, and the point already we have discussed that the continuous or high doses of estrogen or progesterone should be avoided, right? So because when we give this combination in phases form, so we can decrease or vary the doses of estrogen and progesterone, because in monophasic there is continuous or constant concentration of estrogen and progesterone is being used. But in phasic regime, we can vary the doses of estrogen and progesterone. So in this regime or phase regime, there is no continuous use of progesterone or estrogen, right? So this is the logical answer. The another answer is the clinical answer, that what are the conditions in which this female, on the basis of history of that female, on the basis of comorbidities in that female, right? So the gynecologist or the treating physician will decide, okay, in this female, uh, uh, whether phase regime would be sufficient or efficient, or the commonly used monophasic. Because in normally in our setup we use the monophasic, right? Monophasic. But in there are some specific conditions that already we have discussed. So that physician or gynecologist will decide, okay, this monophasic wouldn't be suitable uh, in that female. So she will decide, right? So in that female, it is better, or ideally we should give the biphasic or triphasic. Okay. Disadvantages of what? Disadvantages of that mini pill or progestin only pill. Few points already we have discussed. And one of the point is slightly higher failure rate, right? Because already in the beginning, I told you why we generally use the combination, because combination is supposed to be the most effective and failure rate is less than the progestin only pill, right? Less reliable contraceptive effect, but because if we don't have other choice, right? Because the female in which we'll have to give the contraceptives, right, having the history of hypertension, having the history of breast carcinoma, or that female is breastfeeding female, that so in that situation we have no other chance, we have no other alternative to give the progestin only pill. Inconsistent suppression of ovulation. So this is one of the reason of the failure, because the combination, usually the suppression of ovulation is more reliable than if we just use the progestin only pills. Increased incidences of breakthrough bleeding. So this is one of the problem, right? So you know normal at the end of menstrual cycle there is a bleeding, that is the menstrual blood flow. But in between that cycle, complete cycle, and the different episodes of bleeding occur other than the normal bleeding, that is called the breakthrough bleeding, that is called the breakthrough bleeding. So if a female is on progesterone only pill, increased chances or increased incidences of breakthrough bleeding. Should be taken every day, 365 days of the year, and at the same time each day, even during menstruation, right? This point already we have discussed. Now this emergency postcoital contraception, and that is also called morning after pill, right? So this is the also labeled as the emergency pill. But key point, and when there is a use, there is a need to give the emergency postcoital contraception when the desirability of avoiding pregnancy is obvious. This point already we have discussed. And when there is a case of rape, unsuccessful withdrawal before ejaculation in a legal couple, condom torn during intercourse, exposure to teratogen, for example, live vaccine or cytotoxic drugs. Because if a female is on vaccine or on cytotoxic drug due to some treatment, so it can be if the fertilization occurs, so it would be a problem in a fetus. So that is legal to use the emergency pills or morning after pill or emergency postcoital contraception, right? So again, we can use the combination of estrogen and progesterone, or even only progestin only pill can also be given. The key point related to this morning after pill is this will show the efficacy or effectivity if we give within these 72 hours of activity. So then it will show the effectiveness around 99%, right? 99%. So we have different preparations, like we can use the estrogen only pills for this purpose, we can use progestin only pills for this purpose, or we can use the combination pills for this purpose. Like if we use the conjugated estrogen, so 10 milligram 3 times daily for 5 days, or if you are using ethinyl estradiol, so 2.5 milligram twice daily for 5 days would be sufficient. Or if you are using mifepristone, so this is one of the preparation, mifepristone. See, and usually in our normal clinical practice, this is one of the preparation that is being used commonly. Mifepristone 600 milligram once, right? And along with one of the prostaglandin, that is the misoprostol, that is the 400 microgram. But this is given once. What is mifepristone? This is the preparation that is sufficient if we use the single dose. The mifepristone 600 milligram once would be sufficient, right? Or the combination of mifepristone along with prostaglandin, that is the misoprostol, and the dose of misoprostol would be 400 microgram. So this is the one dose preparation, right? Or if we can use the progestin only pill like norgestrel 1.5 milligram, again this can be given as a single dose, right? Or norgestrel 0.75 milligram twice daily for 1 day, right? Okay, norgestrel or ethinyl estradiol, the combination can be given, right? So these are the different preparations can be given, right? In case if we have to use or this preparation as emergency postcoital contraception. So what I have discussed now, this is your homework. So that is why I intentionally leave this space as a blank space, and I have told you verbally. So this is your task, this is your homework, and that the preparations or the preparation that can be given once in a single dose, or the preparation can be given for 3 days or 1 day, that I have mentioned, but I have mentioned verbally. So this you can find from the main Katzen book. So this is your homework, this is your task that you will have to do yourself. Parenteral contraceptive preparation, intramuscular injection, medroxyprogesterone, acetate 150 milligram intramuscularly, and it will give the coverage or avoid the conception for every 3 months, right? So if a female, they are reluctant to take continuous use of pills, they can use this medroxyprogesterone acetate intramuscularly, because this preparation so will avoid the pregnancy or conception for about 3 months. Then we have another option, implantable progestin only preparation, that already we have discussed. For example, Norplant, in which we have norgestrel 6 tubes of 36 milligram. So in the beginning I told you 5 tubes, but now you can correct, it's 6 tubes of 36 milligram each, and it will give protection for around 5 years. Now, what are the pharmacological effects of these hormonal contraception? It interferes the fertility by inhibition of number one, Ovulation, estrogen feedback inhibition of the estrogen component is responsible to give the feedback. Okay, there is sufficient estrogen, so there is no need to further release of estrogen. So feedback inhibition of follicle stimulating hormone and inhibit follicles, inhibit the release of ova, and progesterone inhibit the secretion of LH, and it will promote the inhibition of ovulation. Inhibition of implantation, alteration of endometrium by alteration of hormones, and it will inhibit the implantation of fertilized ovum. Induction of thick and viscid cervical secretion. So what it will do, it will avoid or it will prevent the penetration or reaching of sperm towards the side where this sperm can unite with the ova. So progestin, thick and viscid cervical secretion, so less conductive for passage of sperm. Hypermotility of fallopian tube and uterus, fallopian tube, fallopian hypermotility, so rapid passage of ovum to uterus and prevent normal fertilization. And this uterus hypermotility, expelling of fertilized ovum, especially in postcoital contraception. So postcoital or emergency contraceptive, but it would be effective if we will use the preparation within the 72 hours of activity. Effects on ovary: chronic use of hormonal contraceptive, decrease ovarian function, morphological changes, follicular development is minimal, absence of corporal lutea, larger follicles, stromal edema, smaller size of ovaries, and majority normal menstrual cycle, 2% amniotic for several years. So sometimes using of this contraceptive, there is amenorrhea, you know. Amenorrhea, the cessation of menstrual cycle, right? So in a married woman, amenorrhea is the indication, okay, maybe that female has conceived. But when we check through pregnancy strip, right, and which test we can use to confirm the pregnancy, which test, which laboratory test we, if we are not confirmed with the help of pregnancy strip, so it is recommended to give the blood test to confirm, and there is a different range of exactly as HCG, beta SCG, right? So it will confirm, okay, whether this female have conceived or not. Number one. Number two, even beta SCG showing the negative result. So this amenorrhea could be due to increased prolactin level. This is one of the reasons, right? So how we can decrease the level of prolactin? By using dopamine agonist. Effects on uterus: hypertrophy of cervix, polyformation can occur if a female is taking contraceptives for a prolonged period of time, thickening of cervical mucus, less copious, increase glandular atrophy, and less bleeding. Clinical uses of contraceptives. So one of the main use already we have discussed as contraceptive, and these combination of contraceptives may also be used in the treatment of endometriosis. In case of severe dysmenorrhea, estrogen alone, suppression of ovulation. So if there is a case of dysmenorrhea, so estrogen only pill can be given in that situation. So what are the contraindications and cautions? Thromboembolic phenomena, cardiovascular and cerebrovascular disorder, vaginal bleeding due to unknown cause, avoid in tumor of breast or other estrogen-dependent neoplasm, avoid in liver disease, avoid in asthma, eczema, if a female having history of migraine, diabetes, hypertension, optic neuritis, or convulsive disorders. So these are the conditions. It is better not to give the contraceptives in that female. Factors limit effectiveness of oral contraceptives. So this is important from the BCQ point of view, and this is one of the concepts that is also checked, especially in USMLE exam. Okay, vomiting and diarrhea, because if vomiting and diarrhea occur, there is no time for these preparations for the absorption to reach into the blood circulation. And drug interfere with absorption like ampicillin, and the key point, inducers of hepatic enzymes. So this is the concept, inducers of hepatic enzyme. They can interfere the effectiveness of oral contraceptive. For example, uh, we have mentioned two examples, barbiturates or phenytoin, because if a patient, let me explain this, if a patient is taking, or female, because if a person is taking oral contraceptive and there is no comorbidities, we are not going to say that female is a patient, so this is one of the interesting points. So that is why we use the term pills, because we can also use the term tablets, but if we say tablet, so that means that tablet or that drug is being used to treat some disease. And contraception, conception is not a disease, it's a normal physiological phenomena. So if we are using the preparation, basically we are not treating any disease. This is very interesting point. We are not treating disease, but we are using these preparation to avoid the normal physiological phenomena, to avoid, to inhibit the conception, right? This is very interesting. But if a female is having comorbidities, or like taking drugs for another problem, so it may produce the drug-drug interaction. Suppose a female having a history of epilepsy, right? And due to its epileptic attack, that female wanted to avoid pregnancy, right? So if a female is taking oral contraceptives, and at the same time she is taking anti-epileptic drug, right, like phenytoin, so there is a chance of conception. Why? There is a chance of conception. Anyone? Anyone? A female having a history of epilepsy, and for that she is taking phenytoin, and she is taking also oral contraceptive. So correct answer, the inducer means the early or quick drug metabolism, because contraceptives preparations, these are metabolized in the liver. So if a drug, when we say inducer, that means they increase the process of metabolism. When increased process of metabolism, early elimination of drug, rapid elimination of drug. So the person may have drug-free interval, right? Clear? So this is important point. And another scenario that is asked in USMLE exam, a female, a young female, young couple, and university students, they have married, but they have decided that till the completion of their studies, they are not going to conceive. They are not going to become a father or mother of child. So they have consulted with the gynecologist, and different option gynecologist has suggested to them, and ultimately, finally, they have decided, okay, oral contraceptive pills would be better or easy to take. But sometimes after 2 or 3 months, that female again come to the to her gynecologist, and she was very much in aggressive mood, and she discussed with her gynecologist that I have conceived. You told me that it would be effective, but I have conceived. Why does it happen? Why it's happened to me? So when gynecologist asked, okay, during this period, have you taken any medicine? Oh yes, there was a respiratory problem, and unfortunately, I have been diagnosed with the case of tuberculosis, and for treating TB, I am also taking anti-tuberculous drug. So your gynecologist or her gynecologist would say, okay, this is not the fault of these preparation. This is fault of one of the drug that you are taking as an ATT, which is included in anti-tuberculosis therapy. So your answer would be a very correct answer. One of the student has already given me, that is the rifampicin. Rifampicin, and she's right, because rifampicin is the drug that is responsible for this conception, because this rifampicin, this is another example of a hepatic enzyme inducer. So it induces metabolism, and early metabolism or rapid metabolism. So there is a drug-free interval. So there is a period of drug-free interval, and when there is no drug available in the blood, and if conception, so how it can avoid the conception? So conception can occur, right? So okay, so one of the anti-tuberculous drug, this is very interesting. There is another anti-tuberculous drug, but that is not enzyme inducer, but that is P450 enzyme inhibitor, and that is isoniazid, but that is not linked with this. So this is one of the important drug-drug interaction, and that is asked in the exam. So this is all about the oral contraceptive pills or hormonal contraceptives. So I think you must remember what I have told you, what is your homework, so that you will find, even I'm telling you from where you can find, because in emergency pills or postcoital contraception, so estrogen alone preparation can be given, progestin alone preparation can be given, or combination preparation can be given. But which preparation is being used commonly in our clinical setup, and that is the single dose preparation, right? That can be given alone or with prostaglandin, that is the mifepristone, or can also be given with prostaglandin analog. Okay, there is a question, sir. Can you repeat isoniazid? So that was the extra point, but because that isoniazid doesn't have any link with this oral contraceptive. But I told you this is another drug which is included in ATT, having drug-drug interaction, because isoniazid is also a powerful P450 enzyme inhibitor, like rifampicin. Rifampicin is powerful P450 enzyme inducer, and this rifampicin have link with this oral contraceptive activity, because due to rapid metabolism or early elimination, it increased chances of conception. So thank you so much, and this is all about for today's lecture.